Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update. On this beautiful June day, June 4th, we hope you're enjoying during the day. It's been a beautiful morning and just a beautiful day. It's supposed to be nice. Supposed to get warm, supposed to get some real summer weather for the next several days. So hope you can get out there and enjoy it. So we'll take a look at the numbers today. I have some good news to report in the sense that numbers remain down, and we actually have some good news, which I'll get to in a second. 114 people have had COVID-19 since beginning of March 15th, and of the program of the issue in March 15th, and total recovered are 89. Total current positive cases remains at 11, so that number remains steady at 11 and not increasing rather dramatically, which is good to see that. And a total of 13 people have been lost in the update since the follow-up phase. And then finally, the last two things are important. 918 people have tested negative, so again, far surpassing the number of cases that we actually have had. And the really good news to report is that we now only have one person hospitalized and only one death. So we have really turned the corner on this, and now that we're hopefully going to stay that way going forward. So that one person has come home from the hospital, so it's good to see that, and also good to see that we don't have any further problems with anyone passing away as a result of the complications. So good news, and congratulations to that person getting home. I hope you're doing well. So on the Norfolk County end, we have 8,613 cases, 850 deaths associated with those cases here in Norfolk County. And Massachusetts, we have 101,592 cases, and a total of 614,133 people have been tested. Now, turning to local news, the testing site up at Gillette Stadium will be closing on Friday of this week. We have actually been notified that we can actually send all municipal employees up there if we need to do testing. The facility, however, has the number of individuals needing testing up at the facility has dropped off rather dramatically, and as such, the state has determined that they're going to discontinue that testing site up at Gillette starting on following closure on Friday. So that will be there'll be no longer testing available. There is testing available at CVS locations throughout the state, and if you have a concern or question about a testing facility, we encourage you to talk to your primary care doctors first, and then also CVS, I do believe, is offering them in the various locations throughout the region and throughout the state. So certainly you can get those tests if you need them, and we don't and the municipal employees can do that as well. So that's good news to see that they're actually starting to scale back the amount of testing that's needed given the circumstances, and things starting to improve. Businesses are starting to reopen, and that's good news as well. So phase 2 is going to be upon us this week. In view of that, the Board of Selectmen and the Planning Board met last night in a joint meeting to approve a new set of regulations to provide temporary outdoor dining areas for restaurants throughout Foxboro. So if you are looking to add a space for your restaurant so that you can actually do outdoor dining during the summer months, we will have that available to you now, and the process to review applications for that is fairly minimal, but it does require a review process, and we can turn it around fairly quickly if you fill out the paper properly and provide us good indications as to what you plan to do. There's also, excuse me, for people who have liquor licenses, the government has passed a new provision this week to allow individuals with licenses, alcohol licenses, to serve outdoors. If you're interested in doing that, you can apply as part of your temporary outdoor facilities to outdoor seating capacity, and we will include that as part of the process, and you can actually continue to serve alcohol outside as well. Now, if in fact there are two phases to that process. First is that if you're just creating space adjoining your existing restaurant facility, you can do that as part of a phase 1 approval process, which is relatively easy. If in fact you are planning to use a sidewalk, that's a phase 2 or tier 2 type approval process, which requires a little bit more detailed analysis and determination through a couple departments here in Foxboro in order to make that happen. So if you need to do that, we'll let you know, and we'll advise you accordingly. So if you have an application, if you want to file for an application, you can apply through either the town manager's office, or you can apply through the planning board, or you can get have questions answered with the planning board, so that we can assist you in getting that up to date as soon as possible, and so get that process rolling for you. All right, so as far as other important things, of course, the elections are going to be held on Monday on Monday, June 8th, at the Ahern School. So if you're interested in voting, the appropriate steps are being made now to set you up for that. For voting that day, and great to hear that. Great to see that that we're going to be going forward with that. So a lot of people have voted through absentee ballot, but also a lot of people will vote. I'm sure will come out for the actual election on Monday as well. And then following up on that, on Monday, June 15th, we'll be doing town meeting at the high school. Again, we'll be providing appropriate social distancing measures and protections in place so that people can attend safely, and the town can conduct its business and get that done for July 1st. So lots of changes this year because of what's happened, but good news is that we are continuing to move forward, and we have the warrant is a very small warrant this year. It's only 11 articles. In comparison, I think it's probably one of the smallest town meetings that I think I've ever worked on. So it's done by design. Obviously, we want to try and limit the amount of things that need to be transacted because of the concerns that people have about COVID-19. But we're also going to be following up, I'm sure, with another meeting in the fall to try and make further adjustments as needed, based upon the fact that we still don't have a state budget. And so we've made some assumptions as to what that funding will look like. If we need to make further adjustments on that, we will do that. We have made significant changes to downward adjustments in our revenue projections, and also adjusted the budget accordingly. So I think we're in pretty good shape. We have looked at we have had multiple boards look at this. The Board of Selectmen, the School Committee, the Advisory Committee, and all three boards are in full agreement as to the budget that we've prepared and are going to be sending forward to town meeting, along with the capital plan and the articles that have been submitted for consideration at the town meeting. So that has been thoroughly vetted and reviewed on multiple levels, and we're all comfortable with the approach that we're using. So feel free to join us on Monday the 15th, and we'll hopefully get everything done in a timely and orderly way, so we can move forward for July 1st. All right, so moving on, there was one other disappointing bit of news, is that unfortunately the recreation summer program is not going to be able to go forward this year. Not because it wasn't being offered, it was because of the fact that simply we just couldn't get enough people to join this year. So, and I think there is still some apprehension from folks to send kids onto new programs during the early phases, or early to late phases of COVID-19, but still. The concern of that has indicated that folks don't want to actually join at this point. So, wanted to just keep you all apprised of that. Those who have already paid will be receiving refunds for that, and that process is underway now. So, disappointing news, because we would hope that we do even a scaled back version of that this year. I know the Recreation Department is equally disappointed, and know that they worked hard to try and put something in place, but just couldn't make the numbers work, and when that happens, we certainly can't go forward on those conditions. So do appreciate the effort that the Recreation Department put together trying to put that forward, but we understand the concerns that people have about attending programs given the current circumstances. So that's the latest on the local front, and so let's take a look at what's happening on the state numbers. I just wanted to give you just a couple indicators. Newly reported cases as of June 3rd. This is Wednesday's numbers. As of June 3rd, 429 newly reported cases. That's for a total of 101,592 cases statewide. Newly reported deaths as of yesterday was 68. Total deaths is 7,152 statewide for COVID-19 related complications. And new patients tested by molecular testing was 8,362, and total new patients tested by molecular testing was 614,133. New patients tested by antibody tests was 849 as of yesterday, and total patients with a new antibody test is 47,414. All of the measures that have been put in place by the governor and the state of Massachusetts to track where we are continue to be in the green and yellow areas. So that's all good news. And there are no negative trends. There are two positive trends, and that's the COVID positive testing rate, and also in the testing capacity rate. We still have positive trends in that direction. Also, in the areas of in progress, we have a number of individuals who died from COVID-19, number of patients with COVID-19 in hospitals, and healthcare system readiness, and also contact tracing capabilities, all of which are in progress and are doing well, and hopefully will turn green relatively soon. Clearly, the indication of those people in hospitals has trended in the right direction, so it's good to see that happening all across the state. So let's take a look at just a couple other indicators that I think are relevant. First is the COVID-19 cases currently hospitalized. We have 1,684 cases statewide. We have currently cases in the ICU is at 393. Again, that number is down again from yesterday. And the count of cases currently intubated is 263. Again, that number is down from yesterday as well. So good to see those trends continuing. And I think those are the key indicators that we want to take a look at. Again, the average, just by age groups, again, the average age for total COVID-19 cases is 52 years old. That's the average age for anybody who contracted the disease. The average age of total cases reported as hospitalized is higher. It is at the age of 68. That's the average age of a person hospitalized with COVID-19 complications. And the average average age of deaths in total COVID-19 cases is 82. So obviously, the much higher the age, the more danger there is of those people becoming a little more lethal at that age. So clearly, an important thing to consider. So that's some of the latest information that we have. If you go on the mass.gov/doc/COVID-19 dashboard, you can get this same information, and will actually help you to track where we are by across the state and how it's impacting in various different ways, and breakdowns of all the numbers that I've just given to you. It's much more detailed, which I won't share with you now, but certainly you can look at it yourself and take a look at it and to understand it further. Total of 17,300 in total beds are available, and right now we have, and it looks like about a little over 55% or so are actually available for use if necessary, in terms of capacity. So we're still remaining in very, very good position to deal with any further complications from COVID-19. So that wraps up today's story for today. I will, if you have any further things that you'd like to bring on for me to announce on these updates, you can feel free to call me or contact me rather at wkeegan@foxboroma.gov. Happy to announce anything for you. And then also, again, just good news to hear that we're hearing that an individual has returned home from the hospital after being hospitalized for quite some time with COVID-19. So we are down currently right now at one person remaining hospitalized, and hoping that person will come home soon as well. Again, so have a great day today. Hope to see you again tomorrow morning with your latest COVID-19 update. If you have anything you want to send to me, feel free to do so, and I'll be happy to get it out to you. Until then, have a great day. I'll see you next time.